one. We're going to go ahead and record now.
Okay. Thank you all for attending the program tonight on Chemobrain from an occupational therapy perspective. My name is Katie Henderson. If we haven't met yet, I'm an occupational therapy student at KU, and I'm completing my capstone project at Gilda's Club this semester. As I've already kind of introduced myself, I am an OT student, and my capstone project at Gilda's Club, I've just been implementing programs on different cancer-related side effects and how you can kind of try to manage those a little bit to, better be able to engage in the things that are important to you in everyday life. So I just have an interest in OT's role in cancer care as it's an emerging area of practice. So that's the focus for my capstone project this semester. I included my email at the bottom there. If you would like to contact me for any questions or anything like that, I'd be more than happy to answer. I did want to mention, we do have a research study called Emerging from the Haze that I am going to just kind of do an overview of, and we'll give you the contact information and more information in a follow-up email as well. But if you meet the inclusion criteria that's in the left column there for going through chemotherapy and having some cognitive issues, there is a research study that you can look into if you're interested in. It looks like it's 10 weekly Zoom sessions that have kind of education on strategies to manage cognitive impairment that results from cancer treatment, and all of those kind of session content items are on the right side of the screen, so you can look over there to see what it's kind of all about. But this is just an overview of what this study entails, and again, more information will be sent in a follow-up email if you are interested. And here's the contact information. If you're interested in this research study, Jamie Myers is conducting that research study. So you can contact her through the cell phone or the email that's listed on the screen if you're interested. So back to things that I'm doing with my capstone project. I'm hosting OT consultation hours that are weekly on Tuesday afternoons and Fridays 10 to noon, and they're on Zoom. So if you are needing maybe some support with managing side effects of cancer treatment, just some help kind of with the management of those so that you're able to do what you want and need to do each day, you can definitely reach out via email. I'll put my email at the bottom again there, and we can set up a time to work through that and see what strategies might work for you and just talk through things. I can also help with creating goals, just goal setting and problem solving, different strategies, weighing advantages or disadvantages of different solutions we might come up with, and developing an action plan so that you're able to meet those goals and do what you want to do each day. So again, if you're interested in OT consultation hours, you can email me at intern@gildasclubkc.org and we can set up a Zoom session. So just going into occupational therapy's role in cancer care and cognition, specifically, OT is just looking to support one's participation in the activities and tasks that are most important to one's life. So for cognitive changes, we'll get more in depth with this, but cognitive changes can impact one's ability to maintain their valued roles and do what they want to do each and every day. But OT can help with supporting them with adopting different strategies or methods, just different ways to minimize those cognitive effects, so they are less of a barrier to doing those things they want to do. And I did want to mention, if you are experiencing cognitive changes, it's really important to inform your healthcare team that you are having these cognition changes. The information in this presentation is on management from an OT's perspective, but it's not an exhaustive approach to treatment of chemobrain or cognitive impairment. So it's just really important to inform your healthcare team. So an outline for tonight, I'll go over a little background information, what's cognitive or Chemobrain, cognitive impairment. And then we'll go over self-awareness, compensatory strategies, task and environment modifications, cognitive training, exercise, and self-regulation. Just so you know what's coming. And again, we'll have time for questions at the end. So you can write down any questions and let me know at the end. So what's Chemobrain? Also referred to as cancer-related cognitive impairment. It's just kind of an issue in how the brain works to communicate, think, learn, remember, problem solve, all of those different mental abilities that we use in day-to-day life. So it's referred to as Chemobrain, mental cloudiness, cancer-related cognitive change or cognitive impairment. These are all different words that you may hear, and they all kind of mean the same thing. So it can occur anytime before, during, or after cancer treatment. There's been research to show it kind of occurring in all of those different phases. And the development of cognitive impairment is often multifactorial. A lot of different factors I'll talk about that can go into you feeling these cognitive changes, and the exact reason of why you might be having these impairments is not fully understood. So here's a graphic that I found in one of the research articles I was looking at. It's cited in the bottom left there, but just showing the complexity that is involved in cancer-related cognitive impairment. So as you can see kind of at the top there, the different areas of cognition that can be involved. So like with memory, executive functions, attention, processing speed, just all those different functions can be impacted. And then the different factors on the left there that can also contribute to our cognition. So fatigue, anxiety, depression, post-traumatic stress disorders, all of those listed on the left there, those can also factor in to make the cognitive issues you might be experiencing, make them even, worsened. And the cancer treatments in the green on the left are, typically, we think of cognitive impairment with cancer to be associated with just chemotherapy, which is why the Chemobrain, is so often what it's referred to as, but it can actually happen with surgery, immunotherapy, hormonal therapy, radiation. It's been seen in all different types of cancer treatment. I won't go into detail on the genetic factors and biological factors, but there's obviously just a lot going into the cognition that you're experiencing. And then there's definitely different sociodemographic variables and comorbidities that are contributory factors to cognitive impairment as well. And then it does highlight different aspects of management that you can look into. So we'll talk about a lot of these during this presentation, but there's just different, strategies and ways to try to rehabilitate cognitive functions. So I just thought this was a good graphic to explain, to really just show how complex this really is. And I did want to mention before diving deeper, just some safety considerations. So if you are experiencing sudden cognitive changes, it could indicate a more serious issue than the cancer-related cognitive impairment that we are referring to in this presentation. So a sudden cognitive change could mean something like an infection or an adverse reaction to a medication. So if you're experiencing symptoms such as like fluctuating alertness or consciousness, appearing to just not understand like what's going on around them, hallucinations, having agitation, confusion, behavior that's unusually loud or aggressive for yourself or someone those would be some symptoms that could indicate a more serious problem and not just cognitive changes from cancer treatment. So if you do experience those symptoms or someone is experiencing symptoms like that, it'd be important to contact your doctor immediately to just make sure it's not, something more serious. Let me see if I can get to, there we go. So symptoms. Okay. Symptoms that you could experience with cancer-related cognitive impairment, so difficulty concentrating, remembering what you may have done just yesterday, experiencing lapses in memory for things that you wouldn't like usually forget, experiencing slow and disorganized thinking, having trouble remembering common words, and trouble learning new things, and also just having more difficulty multitasking than normal. So, and this isn't, everything that one might experience. These are just some of the common symptoms that can occur. And the components of cognition that are impacted, typically it's attention, memory, executive function. Those are kind of the most often ones that I saw in the literature, but also processing speed can be impacted. Like I mentioned, learning new things can be more difficult, visual spatial skills, and just language in general. So those are all kind of areas that could be impacted with cognition. So we'll go into depth with just a few to make sure we define them and just kind of understand what those, what could be impacted with those. So attention specifically, can be an inefficient concentration when completing a task, losing track of your thoughts, and inability to grasp the main concept of written material. So there's different aspects of attention, such as sustained, divided, selective, and alternating attention. So these could all be impacted with cancer-related cognitive impairment, or it might not be as impacted as much for you. It just, depends from person to person, but that's kind of the attention component there. Memory, experiencing forgetfulness, inability to recall names of individuals. You can have short-term memory, working memory, or long-term memory impacted there. Executive function, it includes indecisiveness and inability to multitask. Other components of executive function include planning, organization, reasoning skills, being able to problem solve, self-awareness, and just decision-making, like I mentioned. So those are some aspects involved that can be involved for individuals with cancer-related cognitive impairment. So a little bit on the prevalence. Chemobrain is a very common symptom that can occur with cancer treatment. And specifically in one study, when they surveyed cancer survivors, and over 85% of them were breast cancer survivors, approximately 2.83 years after completing the treatment, 75% of those individuals explained that they had cognitive complaints that they felt was due to the cancer treatment. And of those individuals with the cognitive complaints, 76 reported it being a barrier to work resumption. So it just shows the big impact that cancer treatment can have on cognition and the areas of life as well. So for most of these individuals, the start of the cognitive complaints was during their chemotherapy. And then the second biggest group was those who experienced a start of cognitive impairment after chemotherapy. And then it was really dispersed among, all the different times after that. But for these individuals, experiencing these cognitive complaints was strongly associated to receiving chemo, having sleep difficulty, and pre-existing knowledge about cancer-related cognitive impairment. I thought it was interesting. It noted that, those with pre-existing knowledge about cancer-related cognitive impairment, they might understand more of what they could experience in the future and then report more of those symptoms potentially. But just realizing that having the knowledge doesn't necessarily correlate to a decreased risk of those issues. You just might be more aware. But also interestingly, in this study, most individuals were women, a younger age, which it noted that potentially older adults might think that more of the cognitive issues that they're experiencing could be part of just aging. So maybe more younger aged individuals noted it. But if you see more treatment, more of those individuals explained having these cognitive complaints, a more extensive cancer diagnosis, and more likely to be employed. So those are just some interesting findings there. Outlook, it can really vary. You can have more short-term, more long-term, or even delayed onset of cognitive changes. But most cognitive changes experienced are just for kind of a short period of time. But for others, it can last for years or persist in their everyday functioning. So if it is kind of persisting more and affecting your day-to-day life, it's important to, talk with your medical team about that and see what kind of strategies you might be able to use to, decrease that effect that it has. Speaking of that, the impact on life that can occur, like we mentioned, reduction in work productivity can occur. It can affect the quality of and ability of your doing everyday activities. Like you might have feel like you have more effort doing simple things than you used to, and also just difficulty doing the daily routines that you used to. It could compromise adherence to treatment if you're feeling these changes. There could be financial impact, just like more difficulty, managing finances. An emotional impact. It's also been noted that some avoid social situations and just having a diminished sense of identity and role fulfillment. So like I mentioned, exact cause unknown, but many different cancers and treatments can be associated with cognitive changes. It's not just with chemotherapy as we often think of. And while we don't know the exact causes, we do know that additional factors, like we talked about, like anxiety, stress, fatigue, having a busy schedule, just there's a lot of additional factors that can contribute to cognitive issues. So just kind of seeing what factors might be also contributing to your cognitive impairment, as those, you might be able to manage as well. And if you can manage additional factors, it can minimize the impact that has on cognition and the impact that cognitive changes then have upon your life. So these contributing factors, like you mentioned, anxiety, depression, stress, fatigue, nutrition deficiencies, insomnia, pain, sleep problems, weakness, alcohol use or other substances, other medication used to treat cancer or side effects, conditions such as high blood pressure or diabetes or infection and other factors. All these can really just exacerbate the cognitive impairment that you could have. So trying to manage certain things like these can really help manage cognitive changes as well. And it was noted that fatigue and insomnia are frequently associated with cancer-related cognitive impairment. So I did want to just review this one study before getting into more of the content, because the kind of interventions they use in this study are many things that I'll be using throughout the rest of the presentation. So this is called Memory and Attention Adaptation Training. And it's cognitive behavioral approach of applying adaptive strategies to reduce the impact that cognitive impairment has on one's functioning, their quality of life, by helping them manage it better and cope. So individuals that participated in this training felt that they had improvements in their cognitive functioning, specifically with processing speed and verbal learning, and also had an increase in quality of life. So components of this were education on attention and memory, self-awareness training, so identifying those at-risk situations that could make cognitive issues occur or make them worse. Also self-regulation, so doing relaxation or other meditative approaches to manage stress, and also working to schedule and pace your activities more purposefully. And then also compensatory strategy training, so using internal and external strategies to help manage the cognitive changes you're experiencing. So I will be going over these different aspects in the rest of the presentation. So starting with self-awareness. So I did want to mention metacognition is a component of cognitive functioning. It's just that higher order self-awareness and monitoring your own cognition. And that's kind of, incorporated with just self-awareness in general. So just identifying problems you may have in your cognitive abilities can help you then with developing methods to overcome this and solutions, so that you're just kind of aware of the cognitive issues that might present itself and are able to manage them the best you can. So going off of that, a way to self-monitor problems that you may be having is just making a note of when you experience memory or other cognitive related problems, just noting what's going on when it occurred, what you were doing, any medication you were taking, time of day, and then looking into those other factors that could be contributing. So what's the environment like? What was the situation? How was your mood and emotional state? Other side effects you experienced, or just mental challenges that could have offset the issue that you may have had. So why self-monitor the cognitive changes that you're having? It's important to just learn what might cause these issues so that, like I mentioned, you can develop at-risk situations where you might experience these problems, and then can better, understand when certain cognitive issues might present itself, and also, just navigate that a little bit easier. It can help with planning, so avoiding scheduling important or cognitively demanding tasks during times that you may feel that you often have some cognitive issues present itself, and also just having this record of what you've experienced, and just, kind of the details regarding the cognitive issues that you experience is helpful for your doctor when discussing these changes that you're having. So just having this like objective, sheet of, self-monitoring can be really helpful to show your doctor. So I included a little example on the left here, but this sheet will be something that is sent out to you in a follow-up email, so that you're able to, monitor the cognitive issues you might be having, and then, just help with managing, and then talk with your doctor as well. So we'll move into compensatory strategies, and these are just learning new ways to complete daily tasks to help with the managing of the cognitive impairments that you might experience. So internal strategies, these are just methods of mentally manipulating information to increase the likelihood of recalling it in the future. So certain strategies include visual imagery, so just making a mental picture in your head of whatever you're trying to remember. Rehearsal or mental repetition, that's just repeating information you're trying to remember either out loud or in your head, can help you to remember it just the more you kind of repeat that. Chunking is a strategy where you kind of put parts of what you're trying to remember into smaller groups rather than trying to remember everything all together. So like, for example, like if you were trying to remember things on a grocery list, like chunking it together by, fresh fruit or vegetables or like frozen foods, things like that. So that can help you remember many different, parts of what you're trying to remember. And then mnemonics, like mnemonic devices, so attaching letters or word associations to things to remember something, even bigger. So external strategies are more of those things like using, different objects or things like that externally to help remember. So memory notebooks are something that you could use to just jot down any sort of important information. So medical information or passwords, things like that, and just keeping it in one spot so that you're able to easily reference, and then you don't have to like try to remember all that information on your own. Another strategy would be to keep a notepad and pen, or even just using your phone notes app if that's what you are more comfortable with doing. Keeping those with you at all times so that you can always write something down immediately if you know that you'll need to remember it and that it's important for you to remember. So, and then you're able to just refer back to these notes throughout the day and kind of make it a habit of doing so. More strategies to help remember things are setting reminders. So if using your phone is something that is easy for you to do, you can set reminders using an app in your phone, like if you have the reminders app in your phone, or Cue Card is another app that can be used to set reminders that can be helpful. Also just asking someone, if you're, whoever you live with or just someone you're with a lot, to remind you of certain things. Setting alarms on your phone to remember things can be helpful. So using alarms for that. And then using checklists. So before like doing some sort of activity or task that you have to do, making a list of the steps required and then checking them off as you do them. That can be, a helpful thing to do. Also using sticky notes throughout the home for reminders wherever it seems necessary, like writing on a sticky note something, at the front door to remember to take with you, just things like that, or something on your, bedside table to remember. So just things like that. Daily planners and organizers can be really helpful. So that you're able to just write down what you need to do for that day. And then you can also put alarms in your phone to prompt you to look back to the planner, because it will be helpful to just kind of make it a routine to continue to reference it. So planners that you can use like physical planners or phone apps. Again, if you're like, think that using your phone would be most easier. I have heard that specific to like cancer treatment and managing all that is to manage with going through cancer treatment, the CAN plan has been helpful for some, which is, I include the link down there, mycanplan.com, but basically they have different kind of planners and organizers to track appointments that you have. Everything I kind of listed on this slide. They have blood cell count tracker of symptoms, sleep, medication, things like that. There are different versions. Like I mentioned, there's a downloadable version that's $10. And then if you want a physical version that's mailed to you, that's about $46. So depending on that, but they do have free downloads that I thought were really interesting, like sleep tracker and wellness tracker. So just wanted to put that out there if those seem like they could be beneficial for you. And then I did want to mention, so attention restoration theory basically is just that exposing yourself into natural environments can help to improve cognitive processes through restored directed attention. So it's been found to improve working memory, cognitive flexibility, and attentional control. So this just basically means that there is some research to support that engaging in activities like outside in a natural environment can help you concentrate and focus. So whatever it is that you might enjoy outside, just being outside, sitting and just enjoying the fresh air, going on walks, gardening, whatever it is that you might enjoy outside, taking breaks to do that can actually help with cognition. It can have some benefits with attention. So just something that I wanted to note there. Activity, pacing, and scheduling. So some research that I found noted that some individuals that have cancer-related cognitive impairment mentioned that if they have increased awareness of cognitive issues they might be having when they're in unfamiliar environments or just situations that they felt kind of stressed, it could make their cognitive issues worse. That's how they felt. So just working on acceptance and utilization of coping strategies can help deal with the cognitive changes that you might be experiencing. And through that, like planning and prioritizing the different activities and tasks you have throughout your day can really help so that you don't, put yourself in more stressful positions and that you're just kind of, have everything planned ahead of time so that you minimize any cognitive difficulties that might be associated. So, for example, doing certain tasks that might require high concentration during times you feel the best throughout the day cognitively, and also best in regard to other side effects that also can impact cognition. So if there's a time of day that you might feel you have the most energy and are able to think really clearly, maybe planning tasks that you know have kind of more demanding cognitive abilities during those times could be beneficial. And following a regular schedule and routine is also important to just maintain that routine within your daily life, avoiding multitasking, and also just asking for help when you feel you need to conserve energy physically and mentally, so that you're able to do, more, at a later date when you feel that you need to do something more. But it was also noted that with the study that I mentioned up there, that you're likely to notice the cognitive issues you might be experiencing way more likely than anyone else. So just trying to, accept and utilize coping strategies the best you can will help you navigate these types of situations. And going off of that, individuals also noted that adjusting to this new normal kind of negatively impacted their relationship. So some people tried to hide the cognitive issues that they were experiencing because they felt shame and embarrassment towards them. But engaging in socialization with others is actually very beneficial because social situations are really cognitively complex if you think about it, because it requires a lot of flexibility, not knowing what someone is going to say, like maintaining conversation like that. And the environment and just demands are constantly changing. So just trying to, utilize different strategies to help yourself and just cope with the cognitive changes while not making it, lead to you not wanting to engage in social situations at all. Just since, it's important to maintain those habits and continue to socialize with others. Active listening is one method that you can use to help in social situations. So it can just help for compensating for parts of the conversation that might be missed. So just paying attention to one's like nonverbal behavior, their tone of voice. You can summarize what someone said to just rehearse what they had said and understand fully and make sure you kind of heard correctly, and also clarifying what they said to assure that you understand what they're intending. So just, trying to practice active listening has, many benefits socially, but also can help if you miss things in conversation. So I did want to just mention some don'ts here. Just try to not focus on the cognitive symptoms as much as you can, even though I know it can be, probably difficult at times. But like I mentioned, you likely notice these issues much more than other people do. And thinking about it can just kind of make the difficulties even worse. And also, but at the same time, don't keep these symptoms to yourself. Talk to your doctor and family members about that. It's important to rely on the support system you have with managing this, and avoid alcohol and other substances would definitely be good to do. So now we'll move into task and environmental modifications. So some things that you can do with the environment would be just eliminating distractions can, obviously help with maintaining attention, things like that. So just thinking about all different aspects in the environment that could be impacting cognition, trying to minimize background noise, reduce visual distractions as much as you can, especially if you're doing something that kind of requires a lot of mental focus. Just putting yourself in the environment that is most conducive to maintaining concentration. Avoiding busy environments with a lot of noise, visual distractions, people, movement, as that can be overwhelming and put more stress on you. So if you can avoid, just thinking of things like, whenever you shop for groceries, if you maybe go at a certain time that's not as, common to go, if you're able to, as that could just like make it more easier for you. Keeping a calendar and a location that you can easily reference at the beginning of each day and throughout the day. So wherever that might mean for you, and determining a specific spot to put things that you might commonly use. just trying to have a place for everything so that if you do lose it, you know where you usually try to keep that item. And put objects in specific places you'll see them when needing to use them. So like putting objects that you need to take with you by the front door so that you'll see it as you leave the front door, things like that. Or, putting certain things on the bathroom sink to remind yourself like, oh, I need to take this medication or put on this lotion, something like that, to just have it visually there to, put that reminder in your head. Some modifications of tasks to make things easier cognitively, using a medication organizer that, separates medications for each day. If you have many medications to manage, this can make it easier. You can have an ongoing alarm on your phone for the times of day that you need to take the medication. So you don't have to like remember to set an alarm each day or try to remember that time of day. If it's ongoing, it will just go off at that time each day. And then along with the medication, if you have some sort of chart where you can, mark off when you took medications, that can just be helpful so that you don't have to try to remember if you took it or not. If it's just kind of, built into your routine to mark off when you took it, that way you can check back if you're, wondering. Using visuals to remember just in other ways throughout the day, keeping a grocery list on the refrigerator so you don't have to remember something you might need. You can just jot it down right then, making a list of things you need to do on a certain day, and then referencing it at the start of the day. And then just trying to simplify tasks as best you can. That can help with simplifying the cognitive demand that's on these tasks. So breaking things down into smaller steps and then taking breaks between different steps of the task. And also before even starting a task, if it requires a lot of steps, like making a meal, writing down the steps required before starting can be helpful. So now going into cognitive training pieces. So I'm going to touch on some research that was done with web-based cognitive training. So one study looked at using a web-based computerized neurocognitive learning program and cancer survivors that were 6 to 60 months post-chemo who were experiencing cognitive symptoms. They engaged in this, and it was just at their home on their computer, and they experienced improvements in their self-reported cognitive function. So this was a 15-week intervention that was 40-minute sessions per week. And it targeted all different aspects of cognition. So from this research study, it noted where this program was from, and it's at Brain HQ from Posit Science, and it can be accessed at this link. There is a fee to engage in some of these exercises, if I'm remembering correctly. But if you're interested in things like this, you can visit the link and just look at what they offer. Another study involved web-based cognitive training as well. And for this one, the individuals in the study did the cognitive training for 30 minutes a day, 5 days a week for 6 weeks. And they found improvement in working memory and verbal learning at a 5-month follow-up. So the program used was Happy Neuron Pro, and I also linked it down there if you're interested. They do have some free cognitive activities included, but yeah, it had 6 different cognitive domains of different tasks with increasing difficulty. So those are just 2 studies that are using web-based cognitive training, but I did want to note important considerations when thinking about trying to, engage in these like brain exercises. Practicing one form of a cognitive task over and over again isn't as beneficial as doing a variety of different cognitive demanding activities. So like, for example, if you, do crossword puzzles every day, that's, definitely not bad at all. But consider adding in other activities to have more of a variety, to get the most benefit. And then also, as you do certain activities, trying to make it increasingly more challenging would be beneficial. Being good at one cognitive task doesn't necessarily translate to having better functional outcomes in your day-to-day life. So the more that an activity can translate into everyday life, the better. And also trying to just learn something new. So it doesn't necessarily need to be, doing some sort of brain exercise online every day, but just trying to think of, things that you can learn to learn something new that can, be beneficial for a cognition for all of us. But learning something new that you're interested in could be a great way to just kind of, use your brain as well. So now we'll go into exercise and research that has been noted in exercise regarding cognitive impairments. So for individuals who engaged in more physical activity, a study found that the duration of their cognitive complaints was shorter than those who didn't engage in physical activity. So there is benefit to exercise. It can have a beneficial effect on prevention and also management of cognitive impairment. But I did mention here that more research is needed specifically focused on cognition as an outcome measure. I'll go through some more studies, but most studies, the outcome that they were specifically looking at wasn't cognition. It was kind of like just a secondary aspect that they noted in the research. So there's a need for more research, but there's definite beneficial effects of exercise. One study was the Memory and Motion study. So this involved breast cancer survivors within 5 years of their diagnosis who had chemotherapy or radiation and now had more of a sedentary lifestyle, but also had cognitive changes from the cancer treatment. And these individuals engaged in an exercise intervention that had increasing intensity. So this was mainly on aerobic exercise, and the intensity increased to have a goal of 150 minutes of moderate to vigorous physical activity a week, and it was a 12-week program. So compared to the control group that was included, this program significantly improved processing speed for the participants within 2 years from diagnosis. So it did kind of find that individuals that were more than 2 years of diagnosis didn't necessarily have the same benefits as those that were just kind of within the 2-year mark there. But this is just one study. Yoga. So there are a few studies that I mentioned here. The first one was the effect of yoga on cognition for women with breast cancer. And this Iyengar inspired yoga, which I may have pronounced wrong. But this type of yoga incorporates posture, breathing exercise, and meditation. And they did find improvements in perceived cognitive ability and that objective cognitive performance in attention, memory, and executive function. And then another study that was yoga for cancer survivors, or YOCAS. It combined hatha and restorative yoga to incorporate movement, awareness, and breathing. And in this study, participants had a significant reduction in memory difficulty when compared to the control group. So these are just 2 studies on yoga. And then I did look at some study on more walking. So this first one was a home-based exercise intervention of walking at moderate levels, but it showed improvement in self-reported cognition, but not necessarily objective measures. And yeah, it was just a 12-week program. And then the next one that I included here was 6-week program of exercise intervention consisting of walking and resistance band training. And this included, it had an improved self-perceived cognitive function for patients that went through chemotherapy. So yeah, those are just 2 on walking. And I'm going to get through this last bit of the program so that we have time for questions. But the last bit is on self-regulation. So just specifically relaxation and meditative approaches that can be used to manage Chemobrain. So research on meditation, just a kind of an overview, meditative practices have been shown to modulate neurological cognitive processes, so specifically working memory and attention. So there is an impact that meditation can have on cognition, and relaxation and stress reduction can help regulate immune function, which is thought to be involved in cancer-related cognitive impairment, specifically with like the cytokine production. So reducing having relaxation and stress reduction can really help for regulating immune function. And another study showed meditation and relaxation improved subjective cognitive function, specifically short-term memory, verbal memory, processing speed, and it also has been shown to slow cognitive decline. So that was a lot of different kind of research put out there, but there is definite benefits with meditative practices, specifically with mindfulness-based stress reduction. A study showed improved cognitive function after an 8-week mindfulness class. And another study showed breast cancer survivors with cognitive impairment, if they engage in this mindfulness-based stress reduction for 8 weeks, they had actual functional brain changes in attention areas of the brain and improvement in cognitive impairment. And I did want to note that Turning Point offers ongoing mindfulness meditation classes if you're interested. And also we do have a guided meditation class offered at Gilda's Club every first Tuesday of the month. Tibetan sound meditation is just another form of meditative practices that I saw in the literature and used with women with breast cancer and cancer-related cognitive impairment. If they engaged in this, they had some short-term improvement in subjective and objective cognitive function. So this just consisted of breathing exercises, self-awareness and concentration techniques through visualization and sound exercises. So it originates from a Tibetan Bon Buddhist tradition. And yeah, it's just focused on concentration and mindfulness, and at the same time engaging in cognitive tasks. So the last little bit I'll mention here is medical Qigong, which is just coordinated gentle exercise and relaxation together with breathing and meditation. And in a study on cancer patients who engaged in 10 weeks, they had significant improvements in cognitive function, their self-reported cognitive function, quality of life, and reduced inflammation. And also other studies showed increased attention and processing speed in older adults. So I won't go too much more into that, but there is research cited there if you're interested in looking into it more. So this concludes my presentation here. And you can contact me if you're looking for some individualized support, managing any cognitive changes you might be having, or if you have any questions. My email is listed here, intern@gildasclubkc.org. So feel free to reach out. I would be happy to answer any questions or support you in any way that I can. I also wanted to note that as I am a student and I am still learning, I would greatly appreciate any and all feedback you have. This feedback is anonymous, and just anything that you'd like to mention on what was helpful, what you would have liked to hear about, anything else you'd like to share. I would just really appreciate any feedback that you would have. So there's a link here that will be included in the follow-up email, and I'll also try to put it in the chat box here in a minute. So you can do it, right now if you have the time. Here are the references that I included in my presentation. And as Amy mentioned, we are recording this, so you'll be able to reference this PowerPoint and this presentation online on the Gilded website if you are interested in seeing it more. But I will stop sharing my screen.